The uninsured population in the Lakelands region, I think, is real diverse. We're seeing an increase primarily in people who are employed but can't afford the cost of employer-sponsored insurance. We serve as the medical home for about 25,000 patients. Of that, I'd say a year ago, 20% were uninsured. We're probably looking at closer to 30% now. I think the biggest challenge for providers in serving a growing uninsured population is establishing a true medical home and then being able to use that medical home as the home base, as it should be, but also being able to link those patients to all the other levels of care they need, the full continuum of care.
Meeting the needs of the uninsured is very difficult for providers these days, and it is a challenge. But that's one of the reasons why we came together as a group, because together we were able to capitalize on the resources we all have to meet those needs. But the growing population of uninsured is one of the biggest problems we face in hospitals these days.
The Lakelands Rural Health Network initially began back in 2004. That's when I was initially involved. It involved 2 critical access hospitals, Edgefield County Hospital and Abbeville Hospital, as well as self-regional health care initially. Later, we added Lawrence Healthcare System to that mix. The network also involved the Montgomery Center for Family Medicine, of which I'm a part. We also involved the Self Family Foundation, and part of my job as the clinician within the network partners was to form a clinical leadership council. And so we went around early in 2004, 2005, contacted opinion leaders. These were clinical opinion leaders in each of the 6 counties in the Lakelands area, and they all agreed to be on our clinical leadership council. The discussion began to revolve around developing an electronic medical record system for each of the offices, and that's the real advantage for AccessHealth South Carolina. By having data from all of our providers in the area, those that are using EMR, we're able to monitor how we're doing with projects on chronic diseases like hypertension, diabetes. When we can work together as a group and know how we're doing with actual patients, we tend to see physicians improve.
Well, one of the most important reasons why the Health Information Exchange helps us better serve the population is the collection of information, so that wherever the setting is where a patient arrives, we have their most current information available. A lot of times the patients in this kind of a population, they move from one physician to another. They don't have an accurate place where all the records are kept. So the Health Information Exchange allows us to have real-time information at our fingertips so we can provide a better continuity of care.
If one patient is seen in one hospital and then possibly seen in a physician's office, that information can be pulled together electronically and easily accessed immediately for the, say maybe in an emergency room or emergency department, that emergency physician will be able to access that particular patient's information to see what type of medications that they've taken in the past, if they have a history of certain diagnoses, or if they've had any type of lab work done.
The uniqueness of the Health Information Exchange is something we'd like to think that we're the only one doing it, but it is happening across the country. I think that we're the ones right now that are doing it the best. We're far along compared to when we started this 3 years ago, and I think that because of the collaboration of the partners, we were able to get more in tune with it. And in addition to that, the large help of the IT department at Self Regional Hospital was a major force in helping us pull this together.
It's the opportunity to take a basic level of trust and collaboration and build a system around it that's really focused on the patient, focused on a system that will address gaps. We feel like we're doing a great job, and we're very quick to bring ideas to the table, but there are still gaps. There are still patients that, that fall through the cracks and get lost. And we want to make sure that we put together a system of care that involves all the providers at every level and every setting of care that really understands that we're working together.
There's a tremendous amount of trust between the partners. I mean, we're all at the table and we don't pull any punches either. We're at the table, we look at how things that we decide impact us as a group, but also individually. And if we have issues, we try to work through them. But I think the bottom line is that it's all about the people. It's really not about the technology. Technology can happen, but it's all about the people working together. And when you work together for a period of time like we have, you build a lot of trust.
We are very excited about working with AccessHealth South Carolina. I went to the meeting a few weeks ago where we met with the other two partners in Kershaw and Spartanburg, and it was apparent that we're very different in terms of our geographic areas, but we have a lot of the same needs. And I was excited to hear about the technical services that AccessHealth South Carolina would offer us. And I think it's going to be interesting to see as we work together over these next few years how we can make improvements in the care that we provide to our patients.